had a question recently regarding testosterone replacement therapy, and I thought I'd make a video about what I told this person. Here's the situation. 30-year-old male, recreational Brazilian jiu-jitsu athlete. He trains once or twice a week. He's married but has no children, would like children in the future. Recently, he went into a low-T clinic just to see what they would say. They drew a total testosterone level on him, which came back at 350, in the normal range. He says he feels fine, but the provider there said that he could make him feel much better by bringing his total T level up to around 950 in the high normal range by lab criteria through exogenous testosterone. And he was asking me what I thought about this. And this is what I told him. True testosterone replacement therapy has several criteria. Number one, the patient has to have signs and symptoms of low T, such as depression, insomnia, fatigue, decreased muscle mass, decreased bone mass, increased body fat, decreased libido, erectile dysfunction, trouble with intimacy, etc. Number two, there has to be objective lab evidence of low or low normal testosterone levels at least twice. Number three, there is no overt, obvious medical condition that could easily explain these symptoms. For example, on a CBC, the total white count comes back 60,000, and the hematologist determines that this patient has developed untreated acute leukemia. This could easily explain all the symptoms. Or a hemoglobin level of 8.5, severe anemia, could easily explain this. A fasting blood sugar of 262, uncontrolled type 2 diabetes mellitus, could easily explain this. Electrolyte disturbances, chronic kidney disease, liver disease, hypo or hyperthyroidism, acute or chronic prostatitis, prostate cancer, brain health issues such as depression, bipolar. All these medical conditions could easily explain all the signs and symptoms of quote-unquote low testosterone. Another thing to look at is medication side effects. A middle-aged male who is perhaps on a statin for hypercholesterolemia and a beta blocker for hypertension, these medications can cause several side effects, can trigger several side effects, including many of the signs and symptoms of low testosterone. What I told this 30-year-old is, if he decides to proceed with exogenous testosterone, there are several delivery methods. Oral anabolic steroids, which are out of the question long term, topical gels or creams, and most likely intramuscular injections either twice weekly, weekly, or every 2 weeks, or subcutaneous pellets being inserted under the epidermis into the sub-Q fat every 3 months. The first thing I told him to do is to leverage all the natural ways of boosting testosterone and energy. Of course, the most powerful anabolic stimulus is genetics, but that's not modifiable in the year 2023. That may be down the road. The most important modifiable anabolic stimuli are proper nutrition, adequate hydration, high-quality sleep on a regular basis, appropriate training load, followed by appropriate recovery, leading to appropriate adaptation. High-quality sleep on a regular basis is the most powerful modifiable anabolic stimulus at this time. Nutrition is definitely up there, and of course, proper training load is up there also. One important thing I mentioned to him is that within weeks of starting an exogenous testosterone cycle, the testicles will stop producing testosterone and sperm. In addition, he may suffer side effects from testosterone replacement therapy. One of the most important questions to ask any provider that is looking at initiating a testosterone cycle on you or testosterone replacement therapy is, Doc, if I decide to stop cycling due to side effects, cost, inconvenience, etc., what is your plan for PCT, post-cycle therapy, in order to fire up my gonads again to produce endogenous testosterone and sperm? Hopefully this provider will have a good answer. The last thing I mentioned to him is, we often use this phrase testosterone replacement therapy, but it's truly enhancement. A natural combat athlete will have a diurnal variation of testosterone throughout the day. A natural combat athlete who is not cycling, if he or she goes hypocaloric or isn't sleeping well for a while under stress, testosterone levels will definitely naturally drop due to those stressors. But the person on testosterone replacement therapy will stay steady at a certain number. That's not true replacement, that's enhancement. Here's a perfect example. You have two jiu-jitsu athletes, both getting ready for a jiu-jitsu tournament coming up in 4 weeks. 2 weeks prior to the tournament, both of them go hypocaloric, relatively speaking, and increase their cardio in order to cut weight to make the weight division. The natural jiu-jitsu athlete, his testosterone levels will drop. The enhanced athlete, his levels will stay constant, no matter how hypocaloric he goes, or if he's not sleeping well, or not training well, or doing more cardio. The bottom line is anyone thinking about cycling exogenous testosterone, these are some things to think about. Be very careful.